Welcome to Mostly True Psychiatry with Dr. Mellon. Today we're going over hallucinations in all their forms as related to schizophrenia. So this is, again, the symptom criteria A. You have to have at least 2 of them for at least a month to be considered schizophrenia. And one of the big ones is hallucinations. It's often the most obvious first sign. So what is, what is a hallucination as it regards to schizophrenia? It's perceptual experience without any external stimuli. If it's auditory, it has to be perceived by the patient as distinct from their own thoughts. It has to occur in a clear sensorium because we're looking for schizophrenia hallucination. So if it's normal circumstance of having hallucination, it doesn't count. So if you're just waking up, just going to sleep and hallucinating, it doesn't count. If you're currently have a massive sepsis going on and they're in delirium, again, doesn't count, or Parkinson's disease, that kind of thing. This is an example of a study that was done in multiple countries, kind of like Europe, a little bit of Africa thing. They looked at over 1,000 people, and just one of the pieces of information they're collecting is what kind of symptoms actually show up. And for hallucinations and schizophrenia, about 3/4, depending on the sample, went all the way up to almost 100%, would have auditory hallucinations. That's the most common, most important type of hallucination in schizophrenia. Visuals are around 40%, so about half as common, but still almost half of all patients. The visceral hallucinations, they call them Cenesthetic hallucinations, that was about 1/3. So I don't see that asked a lot in American psychiatry, but apparently that's super common. Tactile, olfactory, gustatory, this is like 1 to 7%, not very common, depends on which one. And again, if you even ask it. And sometimes they're wrapped up with their delusions, so that's how we end up actually finding about it in the US. So auditory hallucinations, so it varies from like a single occurrence, during the day to almost constantly tormented. That would be uncommon though, that's a red flag if it's always present. It's often the first obvious sign for schizophrenia. It can be anything from an indistinct muttering to a particular voice to multiple voices to a chorus of voices. It doesn't matter where it comes from. It can be from everywhere, a distinct point or their own head. Where they're perceiving it coming from is not relevant. Some terms, this isn't critical, but it's just, help educate you a bit more. This is a way you could formulate it and think about it when you're writing notes. We've got our famous command hallucinations. They also call them imperative hallucinations. So it's being imperative sentence means to do something. So it's voices that command them to do something. Patients are can easily ignore those, and they're really not important. It's like we've had this legal craziness, and psychiatry will do stuff just to make sure that we CYA basically. But depending on how the study's done, up to half of them have a quote-unquote command hallucination telling them to do something. Most of the commands are going to be violent. And if you go by the basic idea that a person with schizophrenia is more likely to be the victim of a crime than the person is the perpetrator, then half of them already have command hallucinations. It's got to be a garbage piece of information. It's probably more likely malingering or somebody's trying to get out of like a crime that they did. You can have elementary hallucinations, also you could say a nonverbal hallucination, which probably makes more sense. So this is like sounds that aren't voices, banging, car engines, music, indistinct whispering, tapping. Extracampine means it's from far away, so you're hearing something from further than a human could actually hear, so beyond the normal limits of an ability of a human sense organ. So you could say that an auditory hallucination has extracampine auditory hallucination, something like that. There's functional hallucinations. This is kind of a cool concept. Never seen it myself, but I don't really ask it this way, so maybe it'd show up if you asked it that way. So it's where you have one stimuli, and then their hallucination gets superimposed on top. So you can have like the walking around crunching on leaves, and then it sounds like people crying or something, right? It's an auditory hallucination on top of an actual sound. That would be a functional hallucination. Some people believe strongly that there's certain types of hallucinations that are kind of like, quote, schizophrenia until proven otherwise. Like your thoughts being audible, like other people can hear your thoughts. Echo hallucinations, which is basically It's similar to the idea of like the echolalia and catatonia. It's to where the sound or that sentence, few words, keeps repeating over and over. Third person auditory hallucination. So this is like a famous, I think, for Schneider. He loved this one. Auditory hallucination, speaking in the third person, so voices arguing, carrying on a conversation without you, that kind of stuff. And just as a basic idea here, on Schneider's first-rank symptom. So older psychiatrists still believe this stuff. He was kind of a follow-up person from Kraepelin, really tried to be specific and, document what was occurring, and then seeing if there's patterns, very distinct and different from the psychoanalysis of his time frame. He got famous for doing first-rank symptoms, and so he put this little list up together where he's like, these are symptoms of schizophrenia until proven otherwise. And they were put in the DSM 3, I think, but here they are. So if schizophrenia, if they have audible thoughts, delusional perceptions, diffusion of thoughts where other people can hear your thoughts, is kind of what he meant by that. Experience influences playing on the body, so it'd be like the visceral hallucinations. And these kind of things. Voices arguing, that's the third person one. Despite that being said, people think it was true. When they started doing studies of this stuff, even having more than one symptom is like at best 50% versus any other type of cause for psychosis. Schizophrenia doesn't have symptoms that are, at least from my point of view, that are really special to it. It's more of just duration. And the negative symptoms are pretty significant and relevant when they show up. Thought commentary, it's kind of a third person. It's just, these are just different terms people use. Thought commentary, you can say, is just a third person auditory hallucination. That's what I would do. So hearing voices comment on the patient's action, like a sports commentator or something on the radio, just telling what's going on. So that's enough for that. Let's go to, I'm running all the way backwards, sorry. There we go. We're going to fly through the next one. Basically, olfactory and gustatory hallucinations. We don't ask for them, but basically less than 10% of cases of schizophrenia. Used to be commonly asked, like in Kraepelin, Bleuler's, however you say his name's time frame. Often, only time we'd catch it because it's part of their delusion. Somatic hallucinations are kind of interesting. We don't really do it a lot, but having a physical hallucination, right? It could be a feeling of heat, wetness, movement. It could be incomprehensible, like sliding electrovibratory amalgamations, whatever that means. They're often tangled up with their delusions. There are some terms, I've never seen a person use them. So you have haptic, which is a false, these are all hallucinations. Haptic hallucination, false sense of being touched, tickled, pricked. Hygric, like a hydroelectric type of idea. False sense of being wet. Kinesthetic hallucination, false sense of a movement or joint position. Thermic hallucination can be heat or cold related. And then visceral, which some things were referring to it as synesthetic. That's how they ask it in Europe. Which is a hallucination involving visceral, so like organs inside your belly and stuff. It can be burning, rearranging of organs, that kind of stuff. And then visual hallucinations. There's not really much to do this. I tried reading some papers on it and looking around. It can be anything. It could be rays and spots. It could be plays on colors. They could be in black and white or color. Usually going to be in color. Black and white's just less common, even though I can't think of the guy's name. When we get to malingering, he jumps on that as being a sign that it's not actually a real hallucination, the malingering. But some studies said it was up to a third of the visual hallucinations, so I don't know what to think about that. And it can be anything from those little colors and spots to figures to a whole apocalyptic scene, and they're just confused and delusional, and it's hard to tell apart. The one buzzword, kind of weird one to look at, is a Lilipution hallucination, which is hallucinating tiny figures, whatever they are. Basically a guy in like 1920s. It was a psychiatrist, coined it from like Lilipution from like Gulliver's Travels, Gulligan's Island, whatever the hell it is. Gulliver's Travels, I think. And he was on an island with little people, and they tied him down in the like town of Lilipution or kingdom of Lilipution or whatever. So, but they occur in drugs too and stuff. Like DMT is famous for doing it, which is just for folks. It's like ayahuasca. This is a drug that has it. So we'll do a separate video on malingering to try to tell them apart. But you know, it could be any of these things. It could be all of them. It doesn't matter. So that's been mostly true psychiatry. I've already got the next 4 or 5 videos made. So hopefully I just keep putting them out every day or two. Cheers.